Hi there, it's Laura from Women's Health Physiotherapy Center, and today I'm going to be talking a little bit about the pelvic floor and how it changes during pregnancy and the postpartum period. We're going to talk a little bit about what's considered normal and what we know is not normal, and when to be seeking care for any symptoms you might be having after you've delivered baby or while you might still be pregnant, okay? So we're going to talk first about your pelvic anatomy. Your pelvic floor itself are the muscles that attach from your pubic bone at the front, right here, to your tailbone at the back, and then your sit bone on each side. So everything you see down through this area in red are muscles. And those muscles have a couple different functions. So the first function is that they're going to control the sphincters. You're going to control the opening of the urethra. So the urethra is where the pee comes out. It's right at the front. There's the rectum, so that's controlling bowel movements, and then there's the vaginal opening right in the middle. Now, the vagina is not a sphincter, but it's a muscular tube that's well supported by all these muscles that sit down in the pelvic floor. The pelvic floor also holds all of your organs up on the inside. So we have your bladder right in the front, the uterus that sits in the middle, and the rectum that sits right at the back. Now, all of these organs are very tightly and compactly stuck into the pelvis. So you think of everything as tight as it is right now and then putting a baby on top of all of that. There's not a lot of space in there. These muscles have to support the weight of themselves, but then during pregnancy, the weight of the entire pregnancy. So baby, fluid, placenta, and everything else that's sitting way up here. The muscles underneath support the organs inside like a nice tight trampoline that can take pressure and then rebound back up. And we want that rebound action to kind of be maintained and actually strengthen as we make our way through pregnancy and through any kind of changes. The next function is a sump pump control. So the sump pump helps to move fluid throughout the pelvis and the body. So all of the muscles that live through here act to move lymph and blood flow through the pelvic cavity. So they kind of act like a little bit of literally a pump to help move things around. When things aren't working so well in that pumping action, you can get some what we call pelvic congestion or a lot of heaviness or swelling actually through the vulva and the pelvic floor. And then there's the sexual function of the pelvic floor muscles. The muscles through the pelvic floor underneath need to have a rhythmic control, a rhythmic contraction to them in order to orgasm. They also need to have length to allow for bowel movements and to allow for intercourse, and strength to again allow for those contractions. So a healthy pelvic floor needs to be able to contract really, really nicely, but also to be able to let go very well. And that's one of the issues that a lot of women come in with, is that they think that they might be leaking or having symptoms, and it might be because their pelvic floor is really, really weak. But in fact, it might be the opposite, where their muscles are just so tight that they can't control them very well. Now, during pregnancy is when a lot of women will start experiencing some pelvic floor change. It can show up in a variety of different forms, and typically the first thing women will think of is any leaking. So coughs and sneezes that cause little bladder leaks that can sometimes become bigger bladder leaks. Bowel movements can also be changed during pregnancy as well. Sometimes it's leaking, sometimes it's actually hard for some women to go. So pelvic pain is another complaint that a lot of women will have during their pregnancies. Pelvic pain can be a variety of different things, from pubic symphysis pain, so the joint right in here, or some like central pubic pain, hip joint pain, low back pain, low belly pain, are very common complaints that we'll hear of women having during their pregnancies. Vulvar pain or pain of sex can also be attributed to pregnancy as well. These are all things that we can treat during pregnancy as pelvic floor physiotherapists. They're not things that women just have to live with because they're pregnant. After delivery, women might experience pelvic pain, they might experience leaking, they might experience pelvic pressure. All of those things also are things that we can treat as pelvic floor physiotherapists, not things that women have to live with. There's a lot of misconception out there that a lot of symptoms that women are having are just because they've had a baby and it's normal. If your aunt is leaking and your mom is leaking, little bit or coughs and sneezes causing little leaks here and there, pubic bone pain, or sometimes even pain with sex can be considered a normal thing. It's just because you had a baby, you're just going to have to live with it, and that's completely untrue. Postpartum, we treat all of these conditions. We treat those little leaks so they don't become bigger leaks. We treat pelvic pain, low back pain, hip pain to make the postpartum period a lot more tolerable, and not, again, women not thinking that this is just how things have to be now. We treat pain with intercourse. We treat pelvic congestion or any problems with that pump that we were talking about before. We teach you how to use your pelvic floor muscles really well so they can do all of their jobs really, really well. Again, we want those muscles to be able to open and close the sphincters, these spots right here, when you want them to. We want them to be able to hold everything up underneath after delivery. We want all of the organs sitting inside to be well supported and to be working and functioning really well. We want your hip joints, your low back, everything that attaches in and around the pelvis to be working really well. And we can't tell exactly what the pelvic floor muscles themselves are doing unless we do an internal exam. It sometimes is a little bit of a nerve-wracking thing for some women coming in. We promise you it's not as big and bad as you think it's going to be. But we can't get a really good picture on if you're using your pelvic floor muscles well unless we check. We can't tell if you're doing a Kegel properly. So getting someone to do a Kegel just by saying try your Kegels doesn't actually work so well, and we know it doesn't work so well. If we can check, we can find out if your muscles are too tight, if they're not firing at all, if you're bearing down instead of squeezing. All things you can't tell from the outside. When we're doing our examinations as well, we'll check any scars you might have. So we'll check to see if you've had a tear through the pelvic floor muscles or through the vulva. If you had an episiotomy, we'll check that scar as well. It'd be in the area usually down here. We'll check your C-section scars as well to see what the sensitivity is like. Can you contract the muscles that lie underneath them? Are they pulling? Is the scar tissue impacting how the pelvic muscles work? So the mode of exit that baby takes doesn't determine whether pelvic floor physio would be a benefit for you. Just carrying a baby puts a lot of strain on your pelvic floor. The hormones associated with pregnancy put strain on your pelvic floor. The mode of exit is just one of the components, but we check both modes of exit, C-sections as well as pelvic floor muscles. We want to make sure everything is working well together and that the muscles are strong and healthy but still really nice and flexible. We see women at any point prenatally or postpartum. After baby's born, typically we'll wait around 6 weeks until you've had your checkup to make sure everything is starting to heal nicely. But we want to make sure those muscles are working right away. We'll see you typically during pregnancy anywhere from the second trimester up until delivery. And then again, postpartum, if you don't make it to us at 6 weeks, it's not too late. We see some women months later, we see some women years later, but like any other injury or any other assessment, you want it to be done as soon as possible. We'll get the best and fastest results if we can get to any issues quickly. But if it's been a while since you've had your babies, there is still hope, and there is still lots that pelvic floor physio can do to teach you how to use your pelvic floor muscles well, and make sure everything is functioning as best it possibly can to make sure that you're not leaking, you're not having any pelvic pressure, nothing feels like it's dropping or falling, and you're not having any pelvic pain. If you have any questions, please reach out. It's Women's Health Physiotherapy Center. We're really excited to meet you, and you can find us at www.womenshealthphysio.ca. Thank you.